A lucky accident dropped the medicine in our hands. So began a paper in 1886 by two German physicians. What was this lucky accident? Well, they had just diagnosed a patient with worms, and they prescribed the remedy, accepted at the time, of naphthalene. But it turned out that the chemist who filled that prescription made a mistake. And instead of naphthalene, he prescribed acetanilide. This, of course, did not do anything for the guy's worms. However, it did reduce his fever. And the two physicians were stunned by that. They didn't have anything to reduce fever. And as it happened, another lucky circumstance, the brother of one of those physicians worked for a chemical company. And that company looked at this and said, gee, this could be marketable as a medicine. And indeed, they did. They did a few more experiments. It turned out that the acetanilide really did reduce fever, and they hit the market with antifebrin. The first real fever-reducing drug was not without side effects. It did interfere with the blood's ability to carry oxygen, but they didn't discover that until much later. Anyway, this success came to the attention of Karl Duisberg, a chemist at the Bayer company in Germany. At that time, Bayer was a manufacturer of dyes, and they were looking for other stuff to manufacture. They had a huge amount of a chemical called nitrophenol, a byproduct of the dye manufacture that they didn't know what to do with. Well, Duisberg looked at the molecular structure of acetanilide and thought that maybe nitrophenol could be converted to some similar compound that also had fever-reducing properties. And it turned out to be correct. And that was phenacetin. And phenacetin hit the market as a fever and pain reducer, and it was highly successful. It had some side effect too. That didn't become apparent later. It had an effect on the kidneys. And of course, when the side effect of acetanilide became apparent, then they hyped that they had a smaller side effect. Anyway, not much changed until 1947, when it turned out that the reason that both of these substances, acetanilide and phenacetin, worked is because in the body they were converted to a common metabolite, which was acetaminophen, which you might now recognize because that is the active ingredient in Tylenol. So if this was the active metabolite, why not just market that? It was easy to manufacture, and indeed, Tylenol became extremely successful, all because of that lucky accident that happened decades before. But, there's always a but with medications, and the but is that acetaminophen can be toxic at levels not much above the regularly prescribed dose. No one should go above 4 grams of Tylenol a day, and that is 8 tablets of extra-strength Tylenol. Above that, it becomes toxic. And this is not a rare occurrence. Every day in Canada, 12 people end up in emergency rooms because of an overdose of acetaminophen, that is the active ingredient in Tylenol. Some of these are accidental. They just take more because they think more is better. But unfortunately, about 50% of those cases are attempts at suicide. Luckily, there is a remedy. Every emergency room in the country stocks acetylcysteine. When acetylcysteine is injected into someone who has succumbed to Tylenol overdose, it reverses it because this is the raw material the body needs to make a chemical called glutathione, which the body uses to eliminate the toxic metabolite of acetaminophen. One has to be very careful about acetaminophen because at doses just above the regularly prescribed dose, it can cause liver toxicity. Indeed, it is the prime cause of liver toxicity and liver transplants. So one has to be very careful with that. On the other hand, it is a fascinating story because we would not have this useful medicine had it not been for a mistake made way back in the 1880s by a chemist who, instead of naphthalene, gave the doctors acetanilid, and that resulted in fever reduction. All a happy accident.